I had my abdominoplasty or tummy tuck and gynaecomastia procedure or male chest reduction on the 23rd of March 2022. I'm recording this at the end of August 2022. There was so much going on in my mind around needing to get a COVID test and getting ready for the surgery, making sure I had everything set up and dealing with the anxiety that I didn't really get a chance to record this around that time. But I wanted to dial it back a little bit and talk about what it was like preparing for the procedure, the day before, the day itself, and, getting home. Before we get into it, it's worth bearing in mind that these specifics will be different for every hospital, for every clinic, for every surgeon. Also, when I got mine done, the hospital I was doing it at still had COVID restrictions, which meant that I had to be there on my own. It also meant that I needed to have a negative PCR test 72 hours before the date of my operation, and that had to come back negative. And I had to self-isolate from the point of submitting my PCR to the day of the surgery. I had my surgery in March 2022. I had booked it in January for that date. I got lucky that I got it back soon because of a cancellation. Otherwise, the first available date was actually the end of May. So I only have 2 months wait, which flew by, actually went by really quick. Through COVID and through lockdowns, I'd started walking a lot and I got to the leanest I had ever been in my adult life. I had been at a stable weight range for quite a few years before that, so 72 to 78 kilograms. From my heaviest to my lightest, I'd lost around 140 pounds, and I just wanted to get rid of that loose skin. So I figured once I got to the leanest I'd ever been, now would be a good time to kind of just, get that box ticked as well. In that weight range, I'd stayed at that kind of lower end, sort of 70, 72 kilograms for a good few months. So I thought, now is a good time to kind of just get that done. I had been saving for it myself gradually and slowly for a good few years, for about 9-10 years. And then I could never really make it work between finances and just life and work. I guess a little bit of fear as well. So I kept putting it off. And then I think when lockdowns happened and everyone's life kind of slowed down, that kind of gives you a chance to think about these kind of things a bit more. Financially, I was fine for it. There was nothing going on in my life at the time that, really would have gotten in the way. My body was in the right condition for it. I'm in my 30s and I figured recovery-wise, it's going to be easier if I get it done earlier rather than waiting a little bit later. I'm pretty fit, I'm active, I'm fairly lean, and I figured now it just seems like a good time to do it. In terms of preparing, generally for these kinds of procedures, you need to stay at a stable weight for roughly 6 months, according to the documentation I read. I've been in the same weight range for a few years, so that wasn't an issue for me. COVID restrictions at the hospital, like I said, meant that I needed to submit a PCR test 72 hours before my operation and then self-isolate from that point until the date of my procedure. Because that PCR needed to be negative, I started self-isolating at home from 2 weeks before the date I needed to give in that PCR test. I'm living with my family and I was like, okay, I'll eat on my own. I'll come into shared areas when no one else is around, and I'll just stay between my bedroom and my home office space otherwise. And I passed 2 weeks like that. I didn't even go out for a walk. I went to the garden a few times, but I didn't go out for a walk. I had an appointment with the nurse at the clinic just to kind of talk through the procedure and things I'll need to do to prepare, what the recovery is going to be like about 4 weeks before my procedure. And then I had a health check with another nurse at the hospital itself the week before. And that was literally the only time I came out of that self-isolation, just to go to the hospital, go for the health check, and that was it. The day before the procedure, this is when the hospital called me and actually confirmed that my PCR was negative, and it was quite late in the afternoon that time. So on the plus side, I was so stressed and nervous about this PCR test, I didn't really have the energy or the time to actually get nervous about the surgery itself. So that, I guess, kind of worked in my favor somehow. It was only 1 night in hospital, so I didn't need to pack that much, just a couple of changes of clothes. And that includes a button-up or zip-up top, because with the surgery I'm having, I'm not being able to reach overhead, so I needed something that I could change in and out of. And then just things like my phone charger, standard toiletries, and then the support garment that I'd be wearing after my procedure. That's very specific to me. It's important that you check with your own hospital or your own clinic what they need you to bring on the day or what they recommend you bring on the day. That was it in terms of packing, as far as I can remember. And then when I went for the health check the week before, the nurse had given me the special sponge which had some antiseptic in it, and I was supposed to use that to have a really good shower the night before, so I did that. And I also needed to really thoroughly clean out the belly button, because basically my belly button needed to be reconstructed, and just because that's kind of where you have more joints of skin coming together, there's more risk of bacteria and infection there. So like cotton buds, antiseptic, and then just a really thorough shower as well. I couldn't eat for, I think it was 10 hours before admission, and I was going to be admitted at 7 a.m. My last meal, last thing I ate before my procedure was at 9 p.m. 8 p.m. the night before, and that was just a big bowl of oats with some protein powder in it and a lot of peanut butter. I figured something that's going to make me full, something that's going to take a long time to break down. and that's just going to stop me from feeling hungry for a while. You can't drink anything for 6 hours before admission either. I didn't want to get up in the middle of the night to have a glass of water, so I literally just downed, I think, a liter of water almost the same time I had my last meal. And then that was it. I went to bed, and then I woke up super early on the day of the procedure itself. I just had another shower with the antiseptic sponge. I double checked my suitcase, made sure I had everything packed, and then off I went. Going in the morning, I didn't know what time of the day my procedure would be. I just knew I needed to be there at 7 a.m. and it would take 5 or 6 hours in total. My brother took me, he dropped me off outside the hospital because no one could come in. I waited at reception. At this point, nerves were starting to kick in a little bit. Not that much, actually. My mind still hadn't processed that this was actually happening. Yeah, but yeah, nerves started to kick in a little bit. A nurse came to collect me from reception and took me up to my room. And then from there, things happened so quickly that I didn't actually even have the time to think about it or panic. The nurse went through just basically what the day was going to look like, what was going to happen next, and then just some of the standard health screening questions again. So checking my blood pressure, asking about medications, asking about allergies. Then the surgeon came in and just talked me through everything again. He took his markers and drew all over my torso. That was fun. And just to kind of like get an idea of, from a standing position, of where, you know, the incisions are going to be. And then, of course, the actual procedure, he's going to obviously do a more exact measurement, which he did. Then he went, and literally a minute later, the anesthetist came in and just talked through what he was going to be doing and asked about any allergies or intolerances as well. Somewhere in between all that, the catering manager came in, gave me a menu and asked what I'd want to have for lunch and dinner, and I don't even remember what I asked for, but yeah, I gave an order and off she went. After that, I had maybe like 10 minutes where I just basically changed to the surgical gown and my own underwear. Called my family, let them know that I was the first up and I'd be going in a few minutes, and just gave them the number for the ward so they could check in on me if they needed to or if they wanted to. And then just kind of asked for my valuables. So my keys, which I didn't really need, I was up the line, brought them, my phone, my wallet, just to be, you know, locked away somewhere. By the way, don't bring valuables with you, especially if you're going to be on your own. Phone and wallet, fine, you might need it in case of an emergency, but otherwise don't really bring anything else. And that was it. Next thing I know, another nurse knocked at the door and was ready to take me down for my operation. The nurse asked me to confirm my name, what I was having done, and the last time I ate or drank anything. Then she took me down, and then on the way down we just talked about like my weight loss and my experience, and you know, just she was trying to like keep my nerves calm. And then she handed me over to one of the members of the operating team, who again asked me to confirm my name, what I was having done, and the last time I ate or drank anything. He took me to the anesthetist room where they laid me on their table and asked me again to confirm those same 3 things: name, what I'm having done, last time I ate or drank anything. The anesthetist then asked me to confirm those same 3 things again. And then someone put an oxygen mask on me. Another nurse took my glasses. I could feel the gown being undone, and that was pretty much it. That's all I remember from before the procedure, because I was knocked out literally in a few seconds. This was around 7:30, 7:45 in the morning. I have a very vague, hazy memory of someone at some point telling me things went well, but then I don't think I was fully awake until 3 or 4 p.m. The procedure took about 5.5 hours in total. So after I was taken back up to my room, it took another 2-3 hours for the anesthetic to wear off. I woke up very dopey, very groggy, and things are still a little bit hazy what actually happened that day. If you have something like that, you can still feel like the fresh wounds there. I could feel that, but it wasn't in pain as such, I guess, because the painkillers were doing their job. And I remember I just kind of woke up and then just kind of lay there dazed for a bit. After I got a little bit of my sense back to me, I video called my mom. I could barely speak. My throat was very sore. I just said I was fine. They had called the ward a couple of times just to check up on me. The nurse had called them back after I was done just to let them know. But yeah, it was so good to be up and to make that call. And then after that, the rest of the afternoon and evening are very hazy. I remember just laying there and not really wanting to move or do anything. A nurse came to help me go to the toilet, and that, like, getting up and moving the first time after a procedure like that was absolutely terrifying. I kept thinking, what if like one of the wounds comes undone? I'm just kind of like sitting there with an open wound, just thinking, oh, that's no good. Yeah, no, that didn't happen. For the rest of that evening, I just kind of lay there. Someone brought me my dinner. I started, for no apparent reason, watching Downton Abbey on Netflix, which, by the way, I did end up binge watching throughout my recovery. And then the nurse who had been with me throughout the day just came later on and introduced me to the nurse that would be with me throughout the evening, or throughout the night. And gave me some painkillers. And then after that, like, I slept pretty well that night, you know, the circumstances. I took painkillers before I went to bed. The night nurse came in 2 or 3 times just to check on me, check my blood pressure, and see if I needed anything. And that was it. And then the next day when I got up, by the way, there will be another video talking about that sort of first 24, 48, 72 hours after having a procedure like this. So look out for that. Subscribe to the channel so you do get a notification when it comes out. But the main things, the surgeon came to see me first thing in the morning. Then he just talked it through. He said things went really well. He helped me get up and actually undid some of the bandages so I could see my stitches and see my wounds. And like, you can't see it now, but as well as the main wounds on my chest, I had like a second open row of stitches sort of here. That freaked me out because you could just kind of like see this metal wire along your chest. I'm not massively squeamish, but that did freak me out. The surgeon asked me if I have any questions and then asked me what I remember, and that was pretty much it. After that, the nurse changed over again, and the nurse for this day just came in, checked in on me, brought me breakfast, and just said I can stay until whatever time my family can come pick me up. By this point, I was a bit more comfortable with getting up and lying down because I started to move a little bit more. So I did manage to get to the toilet myself. I managed to get my things packed up. No shower, but I had some full body antibacterial wipes with me, so I kind of cleaned myself up with that a little bit. And then I called my family. They were going to come pick me up in the afternoon, so I had a little bit of time just to kind of pass the day. And I just basically ended up binge watching more Downton Abbey. When I knew my family were on their way, I let the nurse know, and she just helped me make sure I had everything packed up. She gave me painkillers for the next few days, talked through care and stuff for when I get home. Those extra external stitches I had needed to come out after 48 hours, so she booked in that follow-up. She talked through and booked in my 1 week and 2 week follow-ups, and then just made sure I kind of understood and knew everything that I needed to do to look after my wounds and to look after myself. Then my family came, picked me up, came home, came to my bedroom, and didn't really leave or didn't really move that much after that for that day. Stairs are manageable, but because you're hunched over with this kind of procedure, it does put all the strain on the lower back. My lower back would start to hurt after 30-40 seconds of walking, so I kept that to a minimum for that day and just kind of chilled and watched more Downton. So that was a build-up the night before and the day of the procedure itself. I will do other videos covering like the first few days of recovery, 1 week, 2 week, 4 weeks, 8 weeks, 5 months. I have most of these filmed already. I just haven't like actually pieced them together yet. If you have any questions, leave a comment and I can cover those in another video. If you want to stay tuned for future videos, please remember to hit that subscribe button.